Welcome to all the participants here. Well, I would try my best to answer all your queries, all your ambiguities that are there in your mind, or just try to root out all your confusions about this writing part. First of all, I would like to tell you that I feel, because I've been working with many students till now, and it's been a long time I've been working with Medcamp. So I feel that this writing part is just all about practice and understanding all the basic information about how to write a letter. If you're going to have a good grip of all the basic information about writing a letter, definitely you're going to, you'll be able to write a good scored letter. I'm really sorry. My Turkish is not good, so I'll be, speaking in English all through, and I think that won't be a problem. So let's start it. I'm going to, share the information that I have with you, but I would really like you to ask the questions in whatever way you are comfortable with. You can ask the questions verbally, or you can just write your questions in the chat box. I'll be there to answer all your queries. So let's start it. The main topic for the webinar was basically to discuss the common mistakes that the participants they make in their letter writing, and that definitely leads to a low score in your writing part. But I'm going to start a bit with the very basic, information about this writing part. This writing part is the third subtest of OET test. In the listening and reading, you have to evaluate and interpret the given information, and you have to give your answers accordingly. But this writing part is basically a kind of the subtest in which you have to produce something on your own. So what is basically assessed in this writing part is how well you're able to communicate in in a normal your medical communications. This is what they evaluate and assess, that how well you can communicate in a written form when you are working in medical health setups. All right, I'm going to start with the different types of letters. All right, I'm going to start with different types of letters that are basically encountered by the candidates when they sit in the writing part. There are 5 basic types of letters. The 3 of them are the most common ones. The referral letter, that's the most...
Sorry to interrupt, but
Yes, please.
your screen is, could you please, share it again? I think
all right. Sure. Okay. Thank you so much for telling me that. I didn't notice that it's not there. All right. Thank you so much. All right. So I was just discussing about the different types of letters. The very first one is the referral letter, which is the most common one that is encountered in by the students, or they receive when they sit in the writing part. And after that, we have the transfer letter, the discharge letter, and the least common ones, or you can say rarely, that the candidates have received till now, is the information letter or the update letter. That's basically kind of same thing. I'm just going to give a brief explanation about these different types of letters. The very first one, the referral letter, in which you receive a patient and you feel like you don't have those expertise to evaluate or to manage the condition of the patient, so you have to refer the patient to some specialists. So that is where you have to write a referral letter. Let me tell you what you're going to receive when you will sit in your writing part. The content that you receive in your writing part is, we call it as case notes. Case notes are basically set of information, all the basic information about the patient, including the name of the patient, the age, details, current conditions, social history, the treatments that the patient had received, all these kinds of things. So we call all that content as case notes. So all that information is always always in the note form, the short form. What you are supposed to do with those case notes is you have to convert that information into proper sentence form, applying your skills of forming a good sentences based on your English language skills. And this is what the evaluators are going to evaluate or assess from your letter. So you have to convert that information into proper sentence form, and that's how you're going to write the letter. So again, those case notes are, they are sometimes very detailed one. They are not very much relevant to what is required to be included in the letter, but you have to extract the relevant information from those case notes. So that is again very important, because most of the times, this is the thing that affects your score a lot. If you are adding in extra information which is not required into your letter, that is not only going to obviously distract the recipient or reader who is going to read your letter, but it will definitely affect your word count as well. The word count for writing a letter is limited. It's from 180 to 200 words. So while writing a letter, you need to stay into that limit. Apart from that, I would also like to share the timings for the writing part. The timings that are set or designated for this writing part are 45 minutes. Out of those 45 minutes, the first 5 minutes are just the reading time. You are not supposed to write anything in that in those 5 minutes, first 5 minutes. So give yourself a good time to go through the case notes that you're going to receive in your this writing part, because understanding and evaluating those case notes is very important. You have to have a good information about what the case notes are telling you, and this could be achieved only when you will give those 5 minutes wholly and solely to skimming and scanning and reading and going through those case notes. That's very important. So that's why they have designated the first 5 minutes just for going through those case notes. After those 5 minutes, then you're left with 40 minutes, because this OET writing part is completely of 45 minutes. So first 5 minutes for reading, and the next 40 minutes is your writing time. So now it totally depends on you how you manage those 40 minutes. What I always suggest to my students is that plan your 40 minutes according to your own convenience. Some people, they are really good at reading and skimming and scanning, so they can give little time to reading, and they can start planning their how to write their letter right after the reading time. People, they are not good at planning, so you can plan your time according to that. So, what I would suggest is, like, out of those 40 minutes, give first 5 minutes planning your letter. Now again, planning is very important. What comes in planning is how you're going to put your information separately into different paragraphs. When you're going to write a letter, there are normally 4 to 5 paragraphs that we write within that body part of the letter. So the first paragraph is always the purpose paragraph. That's the most important paragraph, because that is the first paragraph that is going to tell the recipient that why are you writing that letter to the recipient. So that should be very clear, to the point, concise, a kind of paragraph. So after that one, you have to decide what kind of information are you going to add into your second paragraph, what kind of information are you going to add into your third paragraph. I'm going to, in coming slides, I'm going to tell you a bit about paragraphing and how to put your information into different paragraphs. Your letter well, in order to make sure that the structure of the letter is really good. Yes, please.
I'm so sorry. Just let me speak about the next slides. I guess now we're just seeing the main slide in the beginning.
Yeah, exactly. I was
Ah,
just giving the basic information because
oh,
this
okay,
all
amazing.
information is
Sorry.
not in
Yeah.
detail in the slides. So I wanted to tell them about the timings and how to plan
Yeah.
writing a letter.
Because timing
All
and
right,
planning
yeah. So
time management, I guess, in writing is one of
exactly,
the, most
it's very
important
important.
factors. Because many
Exactly,
people think like
exactly.
40 minutes is a very long time, but in the real task, it doesn't really work that
Yeah,
way because you need to know and
exactly.
plan
So
how
out
to,
of the yeah.
manage that time. Yeah.
Exactly. So out of those 40 minutes, if you're going to, designate first 5 minutes planning your letter, then 30 minutes, I feel they are good to write a letter. Again, depends on your speed, your capability, and the last 5 minutes. I always tell all my students to give last 5 minutes proofreading your letter. That is again very important because it helps you to, find out some grammatical mistakes, some spelling errors. These are the common kind of mistakes that you can make when you are quickly writing a letter. So proofreading is again very important. So this is how
Çok
try
ufak
to you should try to plan your letter. Sorry.
Çok ufak, a little announcement. If any of you have
Yeah,
a
yeah.
question about the webinar and how the writing section should be, constructed in the real exam, sorularınız varsa kesinlikle chat'e yazabilirsiniz. Daha interaktif olması amacıyla, in order to make it more interactive, we can ask Amina Hoca and she can, answer all the questions regarding the OET writing
Yeah.
section. Ayrıca çok küçük bir şey
Thank you
daha.
so much.
You're welcome. At the end of the seminar, at the end of the webinar, we are going to make bir çekilişimiz olacak. OET Full paket arasında, katılımcılar arasında bir tane kişiye hediye olarak vereceğiz. Chat'ten yazdım ancak onu da ufak dürüstüne geçeyim.
Okay. Should I carry on?
Yeah, go ahead.
Okay, thank you so much. So this was all the basic information that I just quickly wanted to share with you all. You know, the timings, the types of letters. Again, there is one important thing that I would really like all of you to just try to find out that document that's there on our portal as well. It's uploaded there in form of a PDF file. It's about the assessment criteria, which is again very important because when you are about to write your letter or you're about to appear for your writing test or OET test, you need to know the assessment criteria, that how the evaluators are going to assess your letter. There are 6 assessment criterias. Go through that document in detail. If I'll get time, maybe I will explain to you that, but that's going to take a lot of time. So just open the document from the portal and go through it, because understanding criteria is again very important, that how the evaluators are going to, on what basis they are going to assess your letter for. There is different weightage for all different criterias. For example, the weightage for the purpose of the letter is different than the structure, then the grammar skills, flow of the information, so all these things. All right. So the main topic for our webinar was the common mistakes that the candidates they usually make when writing a letter. So I'm going to start off with the common kind of mistakes that the candidates they usually make while writing a letter. So the first one is incorrect tone or a formality of letter. Because as I said in the start, that when you are writing or communicating in a healthcare setup, that's a very formal kind of communication. So your tone and your language, or you can say the selection of the words is very important. That should be very formal, and your tone should also be very respectful and formal. All right. to make sure that whenever you're communicating, you are using the formal sorry, I was just checking the chat box. So you're using the formal way of communicating. For example, when we are talking to our friends, or we are just having communication with our friends or anybody around us, we can say, hi there, I wanted to say this to you. But this is not a formal way of communicating in a healthcare setup. It should be in a very formal way. Like, for example, there is an example on the screen. You can say, hi there, I just wanted to let you know that your patient is not doing so well. So this is a very informal way of communicating about the patient's condition. So the formal way, or the better way, while you are writing or communicating in a healthcare setup, is, I'm writing to inform you about the recent deterioration in your patient's condition. Obviously, a vocabulary is not, using very heavy kind of, or very difficult kind of vocabulary is not that important, to be very honest, when you're writing your letter. If you can just simply write it, I'm writing to inform you about the recent about your patient's condition, which is not or your patient who is not doing well. So if you feel like your vocabulary is not that rich, or you cannot use very high end vocabulary, don't go for it. What is the main purpose in when they will assess your letter writing, is that whatever you are communicating with the recipient, or whoever you are writing the letter to, that should be very clear, and the reader should be able to understand what you're trying to say. So try to use simple vocabulary, concise kind of sentences, short form of sentences, and they should be very clear. Plus, they should be formal. Your tone should be very, very respectful. Try not to add in the kind of words that shows that you are giving an order. It should be always in a requesting way. For example, I'm writing to inform you about the recent deterioration. So this is a very soft way of communication that you can see in this sentence. So this is how I try to avoid these kinds of mistakes. Make sure that you are making the formal communication. Then the second kind of mistake is incomplete or missing purpose. As I communicated earlier, that there are 6 criterias on which the evaluators are going to evaluate your letter on. The very first one is the purpose, and it has got the maximum weightage when they will be assessing your letter. So your purpose should be very clearly stated in the first paragraph. The purpose paragraph, try to keep it as short as possible, as clear as possible. Um, for example, I'm going to just read the example for you, and you're going to get an idea from that the patient came to our clinic on Monday and was assessed. Now this is a very vague kind of like, you are not getting any extra information from this sentence. Better way of writing is, I'm writing to refer Mr. John Smith, normally the age is also there, who presented to our clinic on 6th March with symptoms suggestive of pneumonia. So now see, all the details are there, but they are very, in a very comprehensive way. So this is how we write the purpose paragraph. There are 3-4 things that you always need to write in your purpose paragraph. The very first one is the main objective of writing a letter. For example, you can see the word refer here. So from this one, it's very clear that you are writing a referral, or you are referring a patient to some specialist. Then the name of the patient should be there, the age definitely should be there, and when the patient came to you, and what was the main condition that he or she came to you with. So this is what should be there in your purpose paragraph. Poor organization. When I was discussing it in the start, I was telling about organizing the different, or planning your letter, when I was discussing about the time and all. So this is somehow related to that point, that whenever you receive the case notes, case notes are always very extensive. They have got a lot of information related to the patient, and it's not necessary that all the information is required to be added into your letter, because that's not possible. If you're going to add in all the information, most of the information, it could be irrelevant. So that is definitely going to distract the recipient. It would be of no use for the recipient or reader to read it. Secondly, it will definitely affect your word count. You need to stay in that word count limit. So you need to organize the information very logically into different paragraphs. So this is the paragraphing order which is normally followed while writing a letter. For example, we start with introduction or purpose paragraph. That is always the first paragraph. Then we move on to medical background.
A quick
Now
question about
yes, please.
organization of the paragraphs. Canan Kocaman asked if the body paragraphs is limited to 180
180 to 200 words. Yeah.
It is for each body paragraph, right? It's not for.
It's just for the it's just for the body part of the letter. It doesn't include the details of the recipient, the reference on the top, the salutation. It doesn't include all those things, and
Okay.
also the last, the signature part, that is not included in that. It starts from the purpose paragraph and it ends on your closing paragraph. So
Okay.
this is the part where they count the words of your letter. I hope it's clear. But by the end of these slides, I'm going to show a letter, and I'm going to again tell you that which parts are actually counted for the word count of your letter. So I'm just going to go through it quickly. So the current medication and treatment. Okay, I was just talking about the medical background. Medical background depends. It depends if you want to write the current condition first, and after that write the medical background. Then move on to the medications, the treatment that you're giving to the patient. Then social background or personal background if it's relevant to the current condition of the patient. And lastly, your way forward or request or recommendation to the recipient. So this is how you organize all different paragraphs. All right. There is one more point here that I would like to mention. Organization doesn't only implies on the paragraphs, it also implies on the sentences within the paragraph. Because whenever you're writing a letter, you need to make sure that the flow of information should be very smooth. So whatever sentence you're writing in one paragraph, it should be well connected with the next sentence, in order to make sure that, okay, there is a good flow of information within the paragraph as well. For example, if you're going to look at this example here, she's a smoker. I'm writing to refer her to you. She had chest pain. She lives with her daughter. Now look at this paragraph. Obviously, if we are going to write it on a proper paper, it's going to be a paragraph, but the information is so unorganized. The reader will not get that what are you trying to tell or trying to say. Like, she's a smoker, okay, you're trying to refer her to a doctor. She has this problem and she's living with the daughter. I guess all the information is not relevant. Secondly, it's not organized. There is no proper flow of information. So the better way of writing is, I'm writing to refer Mr. Ellen, a 62-year-old woman with a history of smoking, who presented with chest pain. She lives with her daughter and requires further investigation. So now look at the flow and look at the difference of writing the same information in two different ways. So this is what you need to understand, that the flow of information is very important. It should be very logical whenever you are placing your sentences, even within the paragraph. All right. Then grammar and sentence structure, definitely one of the burning area, I must say, because I have been evaluating like many letters on the portal, and this is a kind of an area which I feel requires a lot of attention. The grammar and sentence structure, because again, grammar and this all these grammatical skills has got a separate assessment criteria, and it has got a good weightage as well. So you need to make sure, and you need to understand that what kind of tenses are you going to use when you are stating a different the scenarios of the patient, and what kind of sentence structure you need to apply. So the common grammatical issues, as I said, is the tense, use of proper tense. For example, if you are saying something about the history of the patient, you need to say or state that in the past form. If you are talking about the current conditions, say it in the present form. And if you are going to suggest something for the future, try to obviously we have to say it in the future tense form. Then try to avoid the fragmented a lot of fragmentation in the sentences. But if you feel like the information is different, definitely fragmentation is required. Avoid run-on sentences, adding in a different kind of information in the same sentence. That will also create confusion for the recipient, because whenever we are communicating in a healthcare setup, our information should be very clear and it should be easy for the recipient to understand. So run-on sentences will definitely create confusion. Now here it's a kind of a run-on sentence. He's smoker. He was diagnosed with diabetes. He takes metformin. He take metformin. Now this sentence structure is not correct. The better way of writing it: he's a smoker. He was diagnosed with diabetes and is currently taking metformin. So placing the connector within a sentence will definitely change the whole concept of the sentence. So use of connectors, use of kind of words that is going to make the flow of information more logical is very important when you are forming the sentences within your this letter writing. Use of articles and prepositions, although articles definitely it's not possible to write sentences without articles. There are three different kinds of articles: a, and the. So you should have a clear understanding of how to use these articles. I'm quickly going to go through the example. Patient was admitted in hospital for infection. So admitted to the hospital. There are some prepositions which are specified for some situations. For example, we never say admitted in the hospital, admitted to the hospital. There is another example, like I'm going to be there on 7 o'clock. Now that's the wrong one. For time we always use at. For place we always use in or on. So these are different prepositions that are specified for different situations. So just try to understand the proper usage of these articles and prepositions, and definitely you're not going to make these mistakes when you will write your letter. Then again, very important thing is irrelevant or repetitive information. As I said, that the word count is limited. It's just you have to stay within 180 to 200 words. So if you're going to add in irrelevant information, or if you're going to repeat the information, it will directly affect your word count. Word count limit is again, it's not like if it's 180 to 200 and you will write 205 words, you will be marked negatively for it. It's not like that. It again depends on your case notes. Sometimes the case notes are very extensive, and it's not possible for the candidates or for anybody who is writing the letter to stay into that word count limit. So try not to exceed 210. If you feel like whatever you are adding in is very important and nothing could be deleted, Again, for word count, if you are going to appear for the physical test, like the paper and pen test, you need to understand your writing. No need to just sit and count the words, because definitely it's going to affect, or it's not possible to sit and count the words. So you need to understand your writing, that okay, if for example, if I write normally 8 to 10 words in a line, so I'll get to know that okay, if I've written these many lines, so this would be my word count. But if you're taking an online test, that's going to be a different one. You will just get to know your word count from there, so that's not be a problem. So try not to add in the irrelevant information or repeat information. This is an example. I'll just go through it quickly. He lives near a supermarket. Obviously, it's very understandable that telling about the patient's exact location is not relevant. So we don't need to tell about where the patient lives, but sometimes the hobbies of the patient or the profession of the patient is very important to be mentioned. For example, if you're talking about a patient who has been brought to you with some cardiac problem, and he is, for example, he's having a sedentary kind of profession, he sits and works for long, so definitely that's a bit relevant to his condition. So in that case, you need to mention the profession or the hobby of the patient, but it's not the same in all cases. Okay, incorrect use of case notes. You need to make sure that you are using the case notes appropriately and accurately. Try not to copy word to word, because I already said that case notes are always in form of notes. Notes means the short form, what you have to do in your letter writing is you have to form proper sentences. So just take the information, convert the information into sentences, and that's how you will write your letter. There is a very good example here. This is how you will receive the information in your case notes. For example, date is there, SOB, 2 weeks, smoker, this much, V's. Now this is the note form of information, very short form of information. How you are going to convert it into proper sentence form is: the patient has experienced shortness of breath for the past 2 weeks. She's a smoker and smokes 20 cigarettes per day and reports wheezing. So see how the notes forms are converted into proper sentences. So this is what is required while writing a letter. And to be very honest, it's not that difficult. The more you're going to practice writing the letters, the better you will do it. You have to read a lot of letters as well. You're going to find many letters on our portal as well. So just go through those letters. The more you will read the letters, you will get to know, or you will get to memorize the vocabulary that is used for different kinds of conditions. So when you will after a lot of practice, when you will start writing your letters, the vocabulary, the sentence structure will automatically start coming into your mind, so it won't be difficult at all. Then the closing is again important. You need to be very clear while you are giving recommendations at the end of your letter. You need to be very precise in that. For example, a very vague kind of a recommendation could be: she might need more help. Now there is no elaboration in that what kind of help is needed, what to do about it. But the better way of writing is: she would benefit from a home visit by the community nurse to monitor her medication compliance. So this is how you need to add in information in order to make the whatever you are writing more explanatory and more clear for the recipient to understand. Very important, abbreviations. Okay, this is again a very common kind of question that I normally receive. Do we have questions till now?
No, right now, we have answered all the questions right now.
All right. Okay. The abbreviations, I won't say that abbreviations are highly discouraged or you cannot use abbreviations at all. It's not like that. Some of the abbreviations, for example, if we see the abbreviation for blood pressure, BP, it's a very common kind of abbreviation that is used in any healthcare setup. And we know that this is something that every doctor or nurse knows. So in such case, we can use the abbreviation for blood pressure, but for the kind of situations or conditions which are not very commonly used as abbreviations, try to avoid those. For example, look at this example. PT is used for patient. CO, care of. He came with this condition. SOB, shortness of breath. It's not that uncommon, but still better to use the full form of it. Into 2 weeks, blood pressure is high. Then he or she is using hydrochlorothiazide. This is a very rare kind of abbreviation used. I would like to share one more thing, one more abbreviation that I came across. That was ER. ER is also used for emergency room, so that is also not very common. So try to avoid those abbreviations. Now PRN is again, when it means when needed, but it's again very rare kind. I won't say that not very rarely used, but still it could be maybe not very easy for the whoever is reading your letter for him or her to understand. So better to avoid that. So look at these abbreviations and how these could be converted into a sentence form. The patient complained of shortness of breath for past 2 weeks. His blood pressure was elevated. He is currently taking hydrochlorothiazide and aspirin and uses bronchodilator inhalers as needed or when needed. So I won't say that don't use abbreviations at all. If you feel like you're going to use that condition a lot in your letter, for the first time, write the abbreviation and write the full form of it in a paragraph. And after that, for the second or third time, use that abbreviation if it's for some condition. But for the frequency of medications, like OD, BID, PRN, better to use them in full form for better clarity. If you feel your word count is getting affected a lot by that, in that case you can use, but still try to avoid them as much as you could. Yeah, that was it. One more abbreviation. Let me just share it for information. That was also a rare thing that I encountered in few of my sessions. I was just going through the case notes. No known drug allergies. No, NKDA. NKDA is an abbreviation which you will usually see in your case notes, and that means no known drug allergies. So this is something that you need to know because that was there in the case notes. So but don't repeat it in the same way in your letter. When you're writing your letter, use the full form of it, like no known drug allergies. All right. Poor linking. I have already discussed this because we discussed one example about it. Use of words like and, moreover, furthermore, as a result. Use these linking words as much as possible because this will make sure that you are making the flow of your information smooth and good. All right. Before moving on to this task, I would like you to look at this letter. This is a good high-scored letter, and this is the overall structure of the letter. You always start your letter with the date. If you feel it's not wrong to write the date after the recipient details, you can write it here as well. But ideally, or what I suggest to my students is to write it at the top. All right. After the date, you are going to write the details of the recipient. One very important thing is because we follow the British format, so you don't have to write a dot after doctor or Mr. or anything like that. Just simple write Dr. Jennifer Lewis, general practitioner, Lakeside Health Clinic. All the address is there for the recipient. Then this is the reference the reference basically means the details of the patient you are actually referring to the recipient. So you have to write the name of the patient plus age. The age could be in any form, you know. If the date of birth is given, write the date of birth. If actual age is given, just write the age. And one thing that's one of the questions that I usually receive from my students is that if we are writing the age here in the purpose paragraph, why to write it here? You know, it's always better to repeat the basic information, because you know, age is something that should be there in the mind of the recipient from the very start of the letter, when he or she will start reading the letter. So better to repeat your age here in the reference and here in the purpose paragraph. Again, if the question comes to your mind that why the age twice, it will affect my word count. So to be very honest, it won't affect your word count, because the word count they will start counting your words from here, from this point to this point. They will not count the words of this part, and they will not count the words of this part. All right, so they will start counting your words from I'm writing to refer, and they will count them till here. So if you're writing the age in the reference part, it won't affect your word count. Okay, after the reference comes the salutation. This is the salutation. Definitely, this is again very important. You have to write it to show that who you are talking to. Then you're going to start with purpose paragraph. The purpose paragraph, as I always say, should be very concise, short, without any extra information. I'm writing to refer Mr. Richard Evans, a 50-year-old male, for ongoing management following his recent admission for acute pancreatitis. So this is the purpose paragraph. Now look at this paragraph. It's very clear that why are you writing the letter? You are actually referring Mr. Richard Evans. For what? Why are you referring? For ongoing management following his recent admission for acute pancreatitis. So you are referring to a specialist for his condition, acute pancreatitis. Then in the second paragraph, you always start with you know, with the condition that the patient was presented to your clinic or to your hospital. So this is where you write it. Okay, with that, if you feel like the history that is there in the case notes is very relevant, you add in the history into this paragraph. If you feel like history is not very relevant, or it's not important to mention the history here, just move the history after you know, the treatment and all that. So after that, you're going to write the treatment that you have, the initial treatment that you have given to the patient, plus the response of the patient to that treatment. And lastly, you're going to close your letter with some closing phrases, whichever you feel is appropriate for your letter. And then you're going to close it with your signature. So this is the whole format of a good written letter. Any questions till here? Do we have questions now?
Right now, we have no questions.
All right. Okay, I have got a small activity here. Then let's move on to that activity, and let's see, because I have already spoken a lot, and I would like to see some practical application of that. So let's. I'm just going to share a document with you, and the same content is pasted there. I would like you to try writing a good purpose paragraph for this information. You know, this is an incorrect kind of letter written. Just try to correct it by keeping the letter that I just showed you in your mind, how to start with recipient details, how to write the date and everything. And let's see how it works. Should we carry on with that? Do we have a question? I'm sorry, the questions are coming in Turkish and I'm unable to understand them.
Right now, they are fixing the problems in the mistakes. The mistakes
All
in the
right, all right. I'm just sharing the document. I'm just sharing the document, and let's do it there on that document, because that would be more convenient for me to, you know, to just monitor the responses. I'm just sharing the link of the document. Meanwhile, if somebody has any question, please ask your questions. I would love to answer your questions or queries, whatever is coming to your mind.
Eren, maybe we can translate the responses to Amina so that she can evaluate if the answers are right or
Yeah,
I'm just sharing. Yeah.
Can we, take a look at the example paragraph again so that we can?
All right. Okay. Here goes the document link, and let's do it on the document, because I guess everybody would be doing there in English, I guess. So it would be easy for me to evaluate. I will share that one too.
Exactly. For example, one of the responses is there's no date of birth written in the, purpose sentence. And
Okay.
the other is
That's the
said
correct
that
one.
it's not informal. It's not an informal way of a purpose sentence. And the last one is it's not written. Who are we writing it?
Okay. So recipient details are not there. Exactly.
Yeah.
It's written to whom it may concern. So that's the
Those were
wrong
the
way of
answers.
writing it. Definitely, we have to write the full details of the recipient. Yeah. So I have just shared the document. I would like everybody to come on that document, and let's work on that. Okay, I can see many of them have joined it. Just leave the first page, copy it, and just write your name, and start doing it, or write the correct form of it. I would request all of you to just leave the first paragraph that I have pasted, and start working on the next one by copying it, because that way the original will stay saved on the top. Yeah, we'll definitely start with the date. Perfect. The recipient details are here.
And in the meantime, maybe we can
And-
share the screen of the documents, Amina, so that the ones who cannot
yeah,
join
sure.
from the link
Yeah,
can
that's
also
a good
follow.
idea. That's a good idea. Perfect idea. That is. Let me share it. And just give me a second. I'm just taking it out. Yeah. Now it's ready to be shared. All right.
It seems as many people are eager to make changes.
They might be a
So
little
now see,
hesitant because, at the beginning it looks a bit,
it's okay.
complicated. but
Like if you want to stay anonymous, it's totally okay. Just don't
Yeah.
write your name on the top, and start practicing it. It's just a practice, a kind of a short activity. To see how much you have understood about it, and if because when you will start rewriting this one, definitely many questions will come to your mind, so you can ask the questions in that way. Otherwise, if Sometimes it's very difficult to understand things by just looking at them, but when you start practically doing something, you get to understand the things better. And then definitely many questions will come to your mind. Yeah, that's a good one. I would say, a nice purpose somebody has written. I'm writing to refer Mr. Peter Johnson. Very good. You haven't written any dot after Mr. A 58-year-old. This is a set format of writing the age. Man, okay, one more thing. Whenever we are using this in the medical form, we always say male or female. So instead of writing man, better to write it as male, 58-year-old male. Or if you feel like here, okay. For urgent cardiology assessment. Nice, a good one. Very good try. First try, that is. So I would like others to give it a try as well. Try writing your purpose paragraph. And the date will come as it is. The recipient details, you can simply copy them as it is. Then you have to write the reference. Then is the salutation, dear whoever recipient is, and then will come the purpose paragraph. See, so the start wasn't that tough. It's just like you need to understand what to write afterwards. So recipient details, date, recipient details, reference, salutation, and then comes the purpose paragraph. So I would like everybody to give it a try. Keep yourself anonymous. It's totally okay, but do give it a try. Try to come up with better and creative purpose paragraphs. Okay, I have got a question here. Reference Mr. Richard Evans. Date of birth. Let me see which is the date of birth. Okay. I would like to answer the question that I've just received in the chat box. If you feel like the date of birth is not given and just the age is given in the in the case notes, just write Mr. Richard Evans of aged 54 or 54 or 58, whatever the age is, or 58 years old. All right, so just write it that way if the date of birth is not given. If date of birth is given, then write the exact date of birth, whatever is given. Sometimes in the case notes you will see that the date of birth is given and exact age is not given. So in that case, somehow you have to calculate the age to write it in the purpose paragraph. But if if the exact age is given, definitely the things will be easier for you. So you just have to write the age as it is. Okay, any other questions, please?
I think everyone is so focused on correcting the paragraph.
All right, so let's see this one. Now for urgent assessment, that was the purpose, right? So whatever you have to write, that should come in the next paragraph. Okay, I think there is a question. All right.
There's one question, and Fatma Hoja asks why we are writing age and his gender, because it's also
Why?
it also exists on the first part. So isn't this kind of writing
all
the
right.
same thing twice?
This is what I explained in when I was explaining before on my slide, that because the reference part will not be counted in your word count, right? When they will count your words, they will start from the purpose paragraph and they will go till the last closing paragraph. So why are we writing the age and the date of birth or whatever it is twice? Because whenever we are talking about whenever we are discussing something in medical healthcare setup, the things should be very clear and the important information needs repetition. All right. Sometimes for example, the age is something very important that should be set in the recipient's mind very clearly. So if he or she is going to read the age twice, definitely he or she will get an image of that patient and how to treat that patient, because everything depends on the age of the patient in whenever you are giving some treatment. So that's why we always prefer to write the age twice. Name and age is always written twice, once in the reference and secondly in the purpose paragraph. Because when you start the purpose paragraph, you also write it in a way that I'm writing to refer. If you will write it as I'm writing to refer the patient for urgent cardiology, again it doesn't sound that good. We need to elaborate this concrete kind of information that I'm writing to refer. Who are you writing to refer? So you need to again write the patient's name, and the first one will not affect at all, because obviously it's not affecting your word count, nothing at all, because this is very important information, so it's always repeated twice. I hope you're clear, Dr. Fatma. All right, thank you. Yes, any other question, please? You're welcome.
I think we are running out of time eventually.
Yep. Okay, so the second paragraph, whoever is writing, thanks to that one person, whoever is completing it, because definitely the others are there to learn from it. So so the second paragraph is also good to start with. He came to our clinic, or better to start with the name. Came to our clinic on Monday and he complained. The grammatical errors are there, but it's okay. Thank you so much.